May is Stroke Awareness Month, and tracking symptoms is a key part of getting the right treatment. And here to tell us more about some stroke education efforts, we're pleased to welcome Cheryl Case, the Harrison County Family and Consumer Sciences Extension Agent. Thank you so much for being with us today.
Thank you for inviting us.
Well, since May is Stroke Awareness Month, it's an important time to remind folks of some of the things they need to know if someone they love is having a stroke. And this is actually something that you've been doing through the Extension Service. Tell us about some of the education efforts going on.
Through the Cooperative Extension Service, we've been doing a program in the 17-county Bluegrass area just to help individuals learn what the symptoms of strokes are, to know what the risk, and what to do. One of the most important things that I want to say today for your listeners is time is of the essence. If you think that someone's having a stroke, or if you think yourself that you're having symptoms of a stroke, the very most important thing is to call 911 and get help immediately. When you get help early, there are drugs and medications that they can use to reduce the after effects of a stroke. And all of us have memories of people that have been in wheelchairs or not have gotten that rehabilitation. But things are different today. And as long as you get to the hospital quickly and get to see a professional, then a lot of those after effects can be eliminated.
And what are some of the symptoms that folks need to pay attention to and look out for that as you said, either they're having a stroke or someone that they're with is?
Sudden. The word to remember is sudden. Sudden onset of numbness or a lack of movement, particularly on one side of the body. If the individual is unable to speak, if they're unable to raise their arm, or they have sudden numbness. Sometimes it may be a sudden problem with your vision, either in one eye or in two. And I was in a situation 2 weeks ago in a meeting, and there was a lady who appeared to lean over to talk to her neighbor, and I was kind of in her line of vision, but she actually had a mini stroke, wow. A TIA, right there in our presence. And of course we called 911. Before the ambulance got there, she was able to speak again, but for a short time she wasn't able to. And a TIA, a transient ischemic attack, is a warning sign for that a stroke is coming. Now, sometimes those just kind of take care of themselves, and an individual may think, oh, I'm not going to tell anybody about that. Maybe I just imagined that numbness or that problem. But it's a warning sign, and you do need to get to your physician. You need to describe those symptoms that you had and let the physician do further care.
Well, thank you so much for taking the time to share some important information. You see there at the bottom of your screen the website for the Cooperative Extension Service with offices throughout the state if you're interested in learning more about their stroke prevention education efforts or anything else going on through the Cooperative Extension Service. Thank you so much, Cheryl, for being with us today. We'll be right back with a check of your forecast. Jeff Cornish is live at our latest barbecue. We'll see how things are going there in just a minute.